Children are curious by nature. They can also be suspicious of new things. When it is time for your child to make their first visit to a dentist, how should you approach the experience? Teach them, involve them, care for them is the motto of Pathways Dental Care, where Dr. Walter Hydry will show us the tools your child can use to learn more about their mouths. You're watching Daily Web TV. Dentistry has really advanced, but what can you expect when it comes to family care? We're here today with Dr. Hydry. Now, Doctor, what can I expect when I bring my family to your dental practice?
Well, at Pathways Dental, when you arrive at our practice, you'll find a program that's geared towards children in a way that was developed to understand the development of children from infancy right up into an age where they can go into an adult part of a practice. Dentistry is a field where anxiety with young people is quite significant. So what we have done here in our dental practice is we've brought in the specialists to work with children that really understand their development, they understand their emotions, they understand how to deal with anxiety and unknown experiences. These specialists are called child life specialists, and we've brought them in from the hospital settings, and we work within a really unique program here called our Children's Self-Care Program. So
they're really designed to work just with children, because I guess setting the habits early on is really what we all need to do.
Absolutely. They are trained to understand children and their development. And we in the dental field are very well skilled at understanding how to help children with teeth and with home care. But what we were probably not significant at was one, understanding the emotions of the child. So the child life specialist brings the balance of understanding the child. We bring in the dentistry, and now we have a partnership that makes a lot of sense.
Right, so you're building that relationship from very early on, so it's not a scary, frightening experience.
Right. The initial contact is usually around the age of 2 when a family comes into the office. And a 2-year-old really does respond differently than a 6-year-old. So how do we really work well and establish skills at every stage of development from brushing and home care and understanding?
So how do you work with the children? What exactly do you do?
Well, in our self-care program, we have 3 aspects to it. The first aspect is when a family comes in for a routine hygiene visit. That's called the self-care program. Our child life specialists work with the children on routine cleaning and oral hygiene instructions. We have a second part where if children need dentistry, whereby it's either sealants or fillings or something major, then our child life specialist helps prepare the children for that dental encounter. And during that preparation, they work with the puppets. They work in an appointment that the child actually becomes the dentist, so they are fully versed in the experience that's about to happen.
Right, so they understand the language and meet the people that are going to be working with them?
Correct. They get to be part of the experience before the experience becomes part of them. That integration of the child now to a dental appointment where my assistants are involved in is one that's now been facilitated by a few activities prior, so these children are well prepared for it and they become active participants in their care.
So is there a special place that they go to, or are they sitting in this dental chair? Is it a warm, inviting environment?
Well, in our dental practices, the children's program has their own special environment. It's unrelated and it's unconnected to the dental part, which are adult-related programs. And so in their children programs, in the children room, they have smaller desks, they have mirrors, they have intraoral cameras, they have tools that are appropriate for their understanding and for their ability to work with. And as they graduate and they become older, then we move them towards the adult part of the practice. But that's usually the transitions around the age of 6 to 8.
Right. That to me, it just, as a mom, it makes so much sense. And I think that everybody, you know, I'm sitting here looking at the puppets and the teeth, to sort of relate that to the child, I think that's made huge steps in a dental program.
Well, we found a tremendous amount of success, and families that are wanting really great experiences for their children are coming to us. Families that have had not so great experiences in other medical or dental encounters have decided to, you know, seek our care for the compassion and the type of outcomes that we have with children. The Governor General has recognized this to be one of the most advanced programs in Canada, and we've been awarded one of the highest level of awards for working with children in Canada based on how we do it with the Child Life community.
Well, as a mom, I definitely have a comfort level with that. So thank you so much for your information. And if you want more information, you can go to desiredsmiles.com. I'm Marielle Bradley. I've been talking to Dr. Walter Heidrey, and you've been watching Daily Web TV.